September is Arthritis Awareness Month. According to the Arthritis Foundation, arthritis is the #1 cause of disability in the U.S. Arthritis is not typically preventable, but there are many steps you can take to manage and slow the progression of the disease. And here to talk more about this subject is Dr. Paula Walker-King. Thank you so much for being here.
Thank you for having me.
You're welcome. So let's first start off with, what is arthritis?
Literally, arthritis is a common disease, but there are literally over 100 types of arthritis. Osteoarthritis is the most common, and it causes inflammation of the joints and pain.
So are there any treatments for arthritis?
There are. Primarily, we tend to want to keep the person physically active. I know it may seem, sort of contradictory that, if you have a swollen, painful joint, now the prescription is to move it. But physical activity actually helps decrease the pain and improve the function, as well as improve the overall sense of well-being for the person. Yeah.
So what are the symptoms? Let's start with that.
The symptoms, literally, the person may develop joint pain, swelling, they may have some joint stiffness and decreased range of motion. In addition to the physical therapy that I mentioned before, non-steroidal anti-inflammatory medications tend to be very beneficial for treating arthritis, like Advil, Aleve, Motrin. Often water-based therapy is very helpful. So like aquatic therapy such as water aerobics or swimming, it allows a person to be physically active and yet decrease some of the pain that they may experience with other forms of exercise.
Is it just an age-related disease, or if you want to say?
Osteoarthritis we tend to see in older individuals. However, the other forms of arthritis, we see them in juvenile patients as well. So younger patients. So really, arthritis can strike at any age, depending on how physically active we are. If we're athletic and we overuse certain muscles and joints, then we'll be more prone to developing arthritic changes a lot sooner.
So how does a doctor diagnose arthritis?
Well, usually with history and physical examination, the diagnosis can be made. There may be some supporting laboratory tests that the doctor also obtains to cinch the diagnosis, but typically, if the history and the physical exam corroborate to support the diagnosis, referral will be made to a rheumatologist who's a specialist in arthritis.
Okay, so people sitting at home, if they're having pain or stiffness or something like that, need to see a doctor?
They should see their doctor and at least mention the symptoms, because they don't have to suffer, with the pain and the untoward symptoms of the condition.
That's very important. You don't have to suffer.
No.
All right. Thank you so much, Dr. Paula Walker-King, for being here.
Thank you.
All right. Let's go to Storm Team 9 meteorologist Elizabeth Diamore.